with the beautiful girl that I met made in Japan. The beauty of her face was beyond my wildest dreams.
Hello everyone, my name is Siti Aqifa, Namira Ramadan Ibtri Faria from international class. In this video, I will demonstrate the hand casting procedure for a patient with radial nerve injury causing wrist drop. The patient is Mr. B, a 35 years old, right-hand dominant mechanical engineer. 6 weeks ago, he was involved in a motor accident that caused a soft fracture of his right humerus. After the injury, he developed radial nerve palsy, which result is wrist drop. Based on the assessment, the patient complains that his right hand has torn when it's relaxed. Because of this, he has difficulty writing, typing, brushing, buttoning, opening doors, and lifting objects. During the examination, his wrist is flexed at about 40 degrees. The MCP joints are flexed and the thumb is in adductor position. There is no spasticity with the modified S4 scale score of grade 0. Manual muscle testing shows severe weakness of wrist extension with muscle grade of 1 out of 5. Fingers and thumb extension are absent with a muscle grade of 0 out of 5. Passive range of motion is full without any contractor, but active wrist extension is very limited. His grip strength is 18 kg on the affected side compared with 42 kilograms on the unaffected side. Okay, the main goals of the orthosis are to keep the wrist in a functional position, prevent flexion contracture, improve hand function during daily activity, increase grip efficiency, and support recovery. For this patient, the casting is done is the functional hand position. This position is chosen because it helps maintain the normal length of the muscle and tendons, prevent joint stiffness and deformity, and provides a better position for hand function. It also helps produce a comfortable and functional orthosis for daily use.
Selamat pagi Pak, perkenalkan nama saya Aqifa sebagai orthotis proteksi Bapak yang akan menemani Bapak pada prosedur casting dan hand position pada hari ini. Oke, untuk posisi Bapak boleh relax dengan bahu seperti ini dan sikunya dilipat seperti ini ya Pak. Okay.
Before casting, I check the patient's skin condition. I make sure there are no wounds, redness, swelling, or pressure area that may affect the casting procedure. Next, identify the important anatomical landmark including the MCP joint, the MCP flexion decrease, the radial stellate process, the ulnar stellate process, the pisiform, and any bony prominence or pressure intolerance area. I also mark the narrowest part of the forearm, which will help with suspension and fitting of the orthosis. Then I determine the proximal trim line approximately 2 feet from the cubital and mark the reference line at 5 cm intervals. These landmarks or reference line help guide the casting process and ensure an accurate, well-fitting orthosis. After identifying the anatomical landmarks, I apply the POP bandage using the slab and circumferential casting techniques. The slab is applied first to provide support and maintain the desired hand position. Then, the circumferential layers are wrapped evenly around the hand and forearm to secure the slab. During this process, I make sure the bandage is smooth without wrinkles or excessive pressure.
Oke Bapak, boleh ditahan seperti ini apa posisinya?
The patient is placed in the functional hand position. The wrist is positioned in about 30 degrees of extension. The MCP joints are flexed about 45 to 70 degrees. The proximal interphalangeal joint are slightly flexed, and the thumb is placed in palmar abduction with opposition. I maintain the position throughout the casting procedure to achieve the desired result. After the cast has hardened, I carefully remove it and check the final cast. In conclusion, the hand casting position for the patient is selected based on the assessment findings and treatment goals. The functional hand position helps improve hand function, prevent deformity, and provides a good foundation for making wrist hand orthosis.
Like cherry blossoms blooming in the mountain in the